Scar tissue is a very popular topic after a knee replacement. It is one of those buzzwords that you probably have read about or heard about from your surgeon or your physical therapist. We do not want scar tissue in the knee if you want to have a good functioning knee. So I'm going to talk more about scar tissue, when to be concerned, what exercises to do to limit scar tissue in today's video. My name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. My YouTube here is dedicated to knee replacement recovery tips and tricks, along with my Instagram, my TikTok, my Facebook group as well. I teach educational courses and exercise classes to help you get prepared for your knee replacement or make your recovery even easier. So please check out my website, succeedcourses.com, for all of that information. Scar tissue is a normal part of the healing process after a knee replacement. Everybody is going to have scar tissue in their knee after a knee replacement. The concern that we have with the scar tissue is where is the scar tissue and how dense or how thick is the scar tissue. So after any type of surgery, you're going to develop scar tissue. That is just the way our tissues heal. The only tissue in the body that does not form scar tissue is bone. So when you break a bone, the bone actually heals back to its regular tissue, which are those bone cells. But if you tear a muscle, you tear a ligament, a tendon, it does scar over and you do lose some of the integrity of the tissue, but it does function pretty normally. Scar tissue is a really great mechanism that our body has developed to help us kind of return back to a normal functioning tissue. So scar tissue is a good thing in a sense. I know with a knee replacement, it probably has a negative connotation to it, but we do need scar tissue to protect us. And scar tissue also forms around the knee implant, kind of protecting it from bacteria. So that's also a good thing, another positive of scar tissue. So with a knee replacement, so here's your knee joint right here. So what happens is scar tissue likes to form in between this tissue right here, in between the bone and the quad tendon. It also likes to form around the kneecap area and kind of below in this patellar tendon. This part down here is called the patellar tendon. We also get some scar tissue along the sides of the knee here on this side and on the other side here. So as you can imagine, if there's scar tissue around the joint of the knee, that can make it really difficult to bend, or it can make it really difficult to straighten. So we have to make sure that we're doing the right exercises and the right stretches to eliminate that scar tissue from getting really, really thick. So what happens is scar tissue forms in stages. It starts out very thin, kind of like hair-like structures, if you can imagine. Just really small types of, they're called adhesions. It's like these little strips of connective tissue. If you stretch and if you do the right exercises, you can kind of break through those adhesions and they don't kind of collect and become thicker and thicker. So that is very important. We want to make sure you're doing the right exercises. So when this becomes an issue is if you aren't bending and straightening your knee a little bit more each week throughout your recovery. So a lot of people, they kind of get stuck. At 3 weeks post-surgery, their knee just isn't bending anymore. It's kind of stuck. It's so swollen, it's so tight that it's not bending anymore. Same thing with the straightening. It just won't straighten anymore. When you get stuck, that's when that scar tissue isn't able to break up. As we talked about, those little adhesions, those hair-like structures. If you continue to do stretches and exercises to break those adhesions, then it doesn't get thicker and thicker. But if you get stuck because your knee is super swollen or it's really, really tight, then those hair-like structures start to collect and they get thicker and thicker. And that's when that dense, thick scar tissue comes into play, and it's very, very difficult to get rid of. It's so difficult that they do have to put you under anesthesia again. The surgeon will go in there and just bend your knee while you're asleep. They don't cut anything open, but they bend the knee, and they can actually hear the scar tissue breaking when you're under anesthesia. So that is what we want to avoid. So there's a couple things to consider here. We definitely need to make sure you are stretching a little bit more every single week with your recovery. And we need to make sure you are managing your pain and swelling. If you're doing too much, you're going to get more swelling and more tightness. That's going to limit your bending. So you kind of see how these go hand in hand. You don't want to do too much and you don't want to do too little. So that's when the physical therapist comes in and we guide you through this recovery process, and we, kind of get you meeting those goals to make sure you don't have scar tissue forming. So that is my specialty. I help guide people through this program, through the recovery. That's what I do in my educational courses. That's what I do in my knee bending course, my new course that just came out. It's specifically designed for somebody who's struggling with, bending problems and their knee just isn't bending. I teach you exactly what to do to get that knee to calm down so we can bend your knee a little bit more. So those are kind of the educational points to behind why scar tissue is forming and when to get worried about it. Usually if you're stuck by 6 weeks and you haven't gotten any further, you need to start talking to the surgeon or your physical therapist or me. You can contact me and we can get you into a program that's going to help you get your knee to bend. So if you've been stuck, you gotta talk to somebody and figure out what to do. If their plan is not working, please reach out to me. Let's get you on the right program to help with your knee bending. So now let's go over some exercises that you can try to help with the knee bending. Place your hands on the chair in front of you if you need to. And with the surgical leg, all we're trying to do is bring your heel towards your bottom. So the goal with this one is to keep the knees in line with each other. If you see your knee shifting forward, just make sure both knees are aligned with each other, and we're just bringing that heel towards the bottom. Both hands facing the stable object, and we're just doing a march with the surgical leg. So big marches with this one. You want to bring that knee up as high as you can towards your chest and bring it right back down. Then your surgical leg, we're going to bring that knee towards your face, interlace the fingers behind the knee here, and we're just letting gravity pull the shin down towards the floor or your heel towards your bottom. We're holding this stretch here. With your surgical leg, we're just going to bend it back as far as you can. You want to feel a really good pull in the front of the knee here. It is okay to have the heel lift up underneath the chair. So you want to push it back as far as you can, and we're holding this stretch here.